All right. Hello, everyone. For this session, we have with us one of our very own, the esteemed Dr. Sheree Simpson from El Shaddai Medical Center. Dr. Simpson, thank you for taking the time to join us. Um, we'll be talking about your medical experience with women in Jamaica who have contemplated abortion and some who unfortunately have made the decision to have an abortion despite advice about the dangers. But before we get into our discussion for today, could you just give our viewers a brief background, including like your experience in medicine, like your years of medical practice and experience on the subject matter?
Okay. I have been in general practice for about 38 years. And in my years of practice, I've worked with more than 100 women who have been in crisis pregnancies, who wanted to abort. And with counseling and prayer, almost 90% of them have decided not to abort their babies. And they have been all happy, all grateful that they did not abort their babies, and none of them had any regrets whatsoever. I've had also, I've been involved in looking up and being a part of looking at studies across the world related to abortion and how it affects women. I was going to share some of that with you. And also, I have in Jamaica had experience with 1 and 2 women who have had abortions and just seeing how the negative effects of abortion was on their lives. And those are some of the things I wanted to share.
Looking forward to hear more. So let's just start on the foundation of the CAPRI report's recommendations. So recently, as you would know, the CAPRI report made some recommendations for abortion on demand, including access by minors without parental consent. During your medical practice, have you ever come across any minor who was pregnant, who faced pressures to abort? And like, could you tell any examples that come to mind and what their situations were like, etc.?
Sure, yes, I could. So I can share one young lady, a girl, actually, a young girl who was 12 years old. And she was raped at 12. She said nothing to anyone. And it was when she was about 6 months pregnant that the nurse at her school recognized that something was wrong. And so that nurse brought her to her mother, and her mother came to the clinic with her. And as I said, she was 6 months pregnant, which is far gone. And I mean, to attempt to abort anyone at 6 months, the risk of death to that mother is very high. Okay? Now, it was decided, her mommy said she would support her, and her mother did. And she went on and had her baby. It was a son she had. And he, as years went on, he was coming to the clinic very often, a very bright little boy who was a joy of the clinic. And when he came to about 11 years old, he did common entrance and he passed for a very good high school. And his grandmother was so proud of him and kept saying he was the only one in the family who had passed for high school. Wow. And she went on later as an adult. Yes, she went on as a young adult to have other children and to have a stable relationship. There was another young lady that I had coming into me. Again, she was a high schooler. Her mother had migrated, and then someone took the opportunity, and she became pregnant at about 13 or 14. And I remember when she came to the office, and it was a nurse again from school that noticed something was wrong. And when she came in, she also was like 20 weeks pregnant. Again, very late in pregnancy. And this is something that bothered me because a number of my younger patients that have come in all come in at around 20 weeks or older. And abortion at that time is really so dangerous for the life of that child. Well, I was the one who just kind of encouraged her I prayed for her. I just the first thing I said out of my mouth when she started crying when I told her you are pregnant was that this is not the end of your life. This is not the end of your life, and we're going to get through, and the Lord is going to carry you through. Well, she went on to go to an institution where she could continue her schooling, and then after that, when she had her baby, she was transferred to another high school, a very prominent high school. And she went on in sixth form and went on to sixth form. She did excellently well in her CXCs. And her aunt supported her, took her to come and stay with her. And her aunt kept up with me and told me just how well she was doing. She ended up getting a very good job and looking after her baby and going on again with her life. I'm going to share one more. There was this girl who was being trafficked, okay? And she was 12, 11 and 12. She's being trafficked by her mother. And when she got pregnant, and she was near 9 months pregnant, persons in the community noticed. And so they called the police. And the police came, and she was taken to stay at a pregnancy resource center, who I'm very close to the person there. She had a baby, and both of them, the baby was a real sweet little girl, but she also went on to continue her schooling. And now, many years later, she's still being cared for by that center. And her baby, who's now a young girl, also both of them doing very well. And then I have one more,
Yes,
which
no
I did
problem.
not see, but I knew about the situation.
Right.
This young she came in also 14 years old, and about 7 months was the first time she was coming in to the doctor. And they made arrangements for her to have a baby, and then her baby was adopted. As soon as she had the baby, they arranged for the baby to be adopted. And he's now a young man, doing very, very, very well. So I share these because for me, sometimes you hear a number of persons talking about minors and feeling that the best thing that you can do for these minors when you see them pregnant is to abort their babies. And there are so much psychological and physical complications to abortions that nobody, sometimes these women don't know about, many people don't know about. And so I wanted just to share now about a young lady that I saw her mommy anyway, okay? Just to tell you some of the negatives, and then I'll just ring them out and I'll give you the studies as well, okay? Now, her mommy came to see me, and we were talking about the whole abortion issue, and mommy said to me, abortion makes them mad. And I said, what? And she said, yes. Her daughter, who was in university, went and had an abortion when she was, I think it was her first year in university, because she got pregnant, and then the father of the child said that it was not his child. She went to a gynecologist and she had an abortion done. Right after the abortion, she really had a bleeding for almost a month. She became very depressed. She wouldn't come out of her bed. And at the end of about a month or so, they had to carry her to a psychiatrist. She was put on antidepressants. She spent most of her time moving from psychiatric ward to psychiatric ward. She used to make a bed for the baby that didn't exist and come out of the room and say, nobody trouble my baby, nobody trouble my baby. And eventually, after 20 years, she died of a heart attack. She never finished her education. She never had a job for one day that she could hold. And she died 20 years. So the young lady ended up not finishing her university studies, not having a job, dying 20 years after the abortion. And basically, her life just ended at that abortion. There was another person that I knew who had an abortion in her 20s again. And then when she, later on in her life now, she got pregnant, wanting to keep this pregnancy. She miscarried and the baby died. A couple of years later again, she was trying again to have a baby, got pregnant, miscarried again, and lost that third child now. And at this point, she is unable to have children anymore, and she just has none. She aborted her first, and she miscarried the next two. And she's just lived her life in so much regret and so much sadness. Infertility is and miscarriages is one of the long-term complications of abortions that's very, very common. Also, there are the immediate complications that we have, like hemorrhage and infections and incomplete abortions, which means half of the baby comes out and the rest doesn't, and that can cause a lot of problems with infections. And then there's always the issue of death. And so I wanted to share that it doesn't matter whether an abortion is done legal or illegal. These complications really are there because of just how dangerous the procedure is. And the farther on in the pregnancy is the worse the complications and the greater risk for death. And the mental health problems really doesn't matter whether an abortion is legal or illegal. That doesn't change. And I was going to share some of the studies that I have seen done in UK and in Europe where abortions are legal. And so, this is, they have done their studies. So I'm going to do the mental health, but before I do, just let me just also remind you all that breast cancer and cervical cancer is more common seen in women who have had abortions. 3 times more common for women who have had abortions is a risk for breast cancer, and 2.3% more common for women who could have cervical cancer. Now, a UK study was done that noted that 80% of post-abortive women experience guilt. They regret their decision. 79% feel a sense of loss. 62% anger. 70% depression. Then a large study also done in the UK showed that the risk of mental health problems was 81%. 34% depression, 37% alcohol abuse, and 110% suicide. A Finland study noted that post-abortive women were 650% higher risk of suicide. So these are just like some serious mental health issues which a lot of persons don't know about, and they're never even told about when they're considering doing abortions. Honestly, can I just share one more story that I have? And actually, I got a phone call yesterday from one of my patients that I had seen a year or so ago. And I had tried to stop her and the father of her baby from aborting their baby. And I spent almost an hour sharing with them. And they were very determined. And I was just as determined that they would not abort their baby. So I shared with them. I prayed for them. I encouraged them with all the complications that could happen. I caused them to understand what are the complications and the risk she was going through, as well as just the fact that this baby is a child with a purpose and a blessing. Well, they chose to follow me. Yesterday, I got a call from her, and I thought something was wrong. And she called and she said, Dr. Simpson, I just called in to say that every time I remember that you stopped me, and she couldn't even say the word abort, you stopped me from doing what I was going to do. And now I have my son. He is so handsome. He's so beautiful. And every time I see him, I just say, thank you, Jesus. And I just wanted to call and say thank you for having stopped me.
Oh, what a testimony.
Honestly,
yes.
Honestly, my heart's desire is that all of Jamaica, all the medical doctors, all medical personnel, every friend would, whenever they know that and are aware of a young person or any person who is thinking of aborting, if they could just spend the time to really support them and encourage them at all costs, they are not. Because once you're able to get them to change their mind, then you always find that they end up being happy that they had the babies, and then you have saved a baby and you have saved a mother from so much distress and trauma.
Your stories that you've shared are very powerful. I just wanted to point out, you were mentioning about the university student that she went to a gynecologist to do the operation. So this is a medical practitioner, someone who is actually experienced in knowing and understanding the human body. It's not just a random person. The same type of practitioner who would do a
Mm.
legal abortion, and the result was unfortunate, very unfortunate. Our hearts really go out to those, women and their families who have had to suffer through these things without, getting the proper encouragement and support that they needed to make these decisions. I just wanted to also go into another argument briefly that is mentioned in the Capri report about you know promoting abortion to help the poor, like those in inner city who believe they cannot afford a child. What would you say to clients like these who really believe that the argument of the quality of life, that they don't think they would be able to give their baby a good quality of life medically? Do you think that what would you be your advice to something like that?
Every child is a gift and has a value, valuable to God and valuable for us. It does not matter whether this child is poor or not. I just thought of Shelly Ann Fraser. You know, Shelly Ann Fraser was born in inner city,
Definitely, yes.
and and if you hear her testimony, she was born in very poor circumstances, and yet look at Shelly Ann today. You can't look at just because someone starts out and it looks as if it's going to be a difficult situation. We are not the ones. We don't know their future, and we are just to value them for who they are and allow them and allow the Lord to help them out, but allow the circumstances to go, because the truth is we can't determine what the future of a child is, and every child has a right to live.
Definitely. So just to highlight certain things that you were mentioning about the contrast, it was really insightful to hear what you had to say, that ironically, the persons who, not really ironic, but based on the arguments given, those who actually kept the child even when they were a teen were able to complete their career, and the examples of from your experience of those who aborted their child in university to continue university were not able to actually launch their career. So that's something that, this is your personal knowledge, and so we really do have to rethink. So just closing, I just wanted you to give advice to any members of the government who are contemplating to cast a conscience vote on abortion. What would you say to them as a medical professional, and and any recommendation to provide support for pregnant women who actually feel vulnerable or pressured in this situation?
Right. Yes, I really want to say again that abortion kills babies and damages women, both physical damage and mental. And what I say to all Jamaicans is, let us work together to support and to help our women and their babies. There are pregnancy resource centers. I feel we should be putting some more pregnancy resource centers across this nation who could help women in their frightened state when they are pregnant, and to help them to go through. We really need to do much more in protecting our women. We really need to do much more in making sure that those who have to go through horror stories of rape and those things, that they can be protected, and that the persons can be found out and be penalized. But I feel that as a nation, there is so much happening in our country when it comes to loss of value of life. When you see how easily and how many deaths we've had already for this year, I really believe as a nation, we should try to preserve life at all costs. And the most innocent life of the unborn baby needs to be protected even more. And that's really just what I say. At all costs, we should work at trying to make sure that we do not legalize abortion in this nation.
Thank you so much, Dr. Simpson. I've learned so much. Your experiences have been really heartfelt, and I really appreciate you taking the time with us today. And God bless you.
Thank you very much for having me, Sarah.